Hand Doctor for Kids and littlearms.org present Kids' Hands Explained, a concise overview of syndactyly. The word syndactyly means joined fingers, but in the lay press it is commonly called webbed fingers because it is similar to the webbing of duck feet. In actuality, it isn't the webbed tissue, but the fingers are joined together, usually without much tissue in between. As obvious as the physical difference is, it is not often seen on prenatal ultrasounds. One recent study has shown that only about a third of all upper limb differences are identified during prenatal ultrasounds, and of those that are detected, the correct diagnosis is only made half of the time. Although the exact cause of syndactyly is not known, the tissue between the fingers is not resorbed during fetal development. This tissue limits the independent action of individual fingers and reduces function. Syndactyly of the middle and ring fingers are the most common, but involvement of the thumb or small finger often require treatment at a younger age. When fingers are tethered together, it affects the appearance of the hand, but most importantly, it eliminates independent finger function, which is especially disabling when the thumb is involved. It's important to emphasize that this condition is not caused by anything the mother did during pregnancy. We generally recommend separating the digits with surgery between 2 and 3 years of age, but sometimes earlier if necessary. We know that surgery can be scary. We use experienced pediatric anesthesiologists, and for children that have both sides affected, we can perform surgery on both sides simultaneously. And even Teddy can come into the OR. For more information on syndactyly and other kids' hand conditions, please visit us on AaronDaluiskiMD.com and littlearms.org.